Hello, everyone. Welcome to today's webinar. I'm Kelly Constantinidis, and I'm a BI analyst here at PDS. First off, I'd like to thank everyone for taking the time to join us for today's webinar, Improving Patient Access with Visual Analytics. Joining me today is Scott Everett. He's the Vice President of Analytics Solutions here at PDS.
Welcome, everybody, and thank you for joining us today. Visualization technology has really gotten to the point in the industry that if you have well-staged data, it's really pretty easy to deliver impactful dashboards to your end users. And you can make them interactive. You can give them the ability to quickly filter and drill and get to where they're really trying to go so that they can understand the whys in addition to what's going on. What we're looking at here is a visualization staged in Power BI, and this is actually a physician compensation report. But I'm showing this particular report because it's interesting that while our topic today is patient access has become such a critical topic for organizations in healthcare these days that they've actually started incorporating patient access metrics into physician compensation calculations. So you can see in this particular report, they're looking at metrics like scheduling utilization, how much of their template is being utilized. They're looking at things like new patient ratios and comparing it to a goal, cancellation rates, really trying to help drive patient access through the way that they compensate their providers. And that's because of the level of importance that we've attached to patient access right now within the industry. It's very much a competitive issue that's going on right now.
So as we talk through patient access today, we're going to talk about finding capacity. We're going to see several visualizations that may help us to identify some bottlenecks that we're finding. And we'll actually look at dashboards in 3 different platforms today: Microsoft PowerBI, Tableau, and MicroStrategy. We're going to look at the impact of access on patient satisfaction. And then we're going to talk about qualifying and discussing some strategies to quantify opportunities for improved access as we walk through this today. So Scott, I'll turn it over to you for our first topic.
Thanks. So obviously one of the keys whenever we begin a patient access initiative with any of our clients is we want to find capacity. We want to be able to get in and take a look and understand where can we get more patients through the door? How can we get them in faster? Is it bottlenecks that we're creating at a provider level based upon the way that we're doing business? Is it something in the system based upon how the templates are set up, what's held, what's frozen, what's blocked? Is it a patient issue? Are the patients demanding to be seen at particular locations during particular times? We really need to be able to go in and look at a lot of different places so that we can find the most efficient ways of improving access. And again, we can improve access mightily, but it doesn't really matter if the patient doesn't feel like the access has improved. So we really need to be able to manage the patient perception of clinical access as well.
So here we have a patient access dashboard that's built out in Tableau. And on the left side of the screen, we have selectors where you're able to select the time frame that you want to look at or different time periods. And then you can focus in on a particular department or a provider. We show the day of week and session breakout, and then we're displaying bumped rates by individual provider. The pie chart indicates appointment volumes by status and whether they're arrived, canceled, and so on. Looking at that booked bubble chart, we can quickly see how utilized our providers are and how each one is based on the size of that bubble. And then that third next line chart allows us to look at trending of that measure over the course of a few months. And we have the appointment volumes in a traditional grid format there on the bottom right-hand side of the screen. And notice how this dashboard really calls out any outliers. For example, up in the bumped rate section, we have a few providers that are maybe at a higher bumped rate than we'd like to see, so we can really drill in and take a closer look at those outliers.
This is really what makes visualization so impactful, is that you're not digesting a bunch of numbers. You're sitting and you're looking, and you can quickly identify, like you said, outliers. But you can also identify things like trends and variability. So one of the things that really stands out to me right now is looking at this session report. and trying to understand why is it that on a Thursday morning we can get 500 patients through the door, but on a Tuesday afternoon or on a Monday afternoon we're barely getting to 200 or 300. What are the differences that are driving that? And we can really dig in and understand, is it a staffing issue, or is it a patient issue, or do we have something going on within our system? So we can really identify the areas that we need to focus on to start finding out what's going on. We can look at statuses like cancellations and no-shows, and I really like to lump in same-day cancellations with the no-shows to come up with kind of a lost appointment ratio, because that ratio can help us find some additional capacity that's out there. And again, when we're talking about variability, the third next graph stands out to me a lot, because third next is a system-generated metric. It's something that you look within the system itself to determine what could happen. And to see it go from 1 month to go from 5.5 to 24 to 6, there's something weird going on in the system that we need to go in and identify. And again, this is a what could happen. What I'd really like to see is what did happen. So if we could look at maybe a different visualization that's out there and dig down a little further. This is a visualization that is created in MicroStrategy, Visual Insight, and this gives a lot more information in terms of appointment lag. An appointment lag, again, is that what did happen. It's the difference between the date the appointment was scheduled and the date of the appointment itself. And you can see right here, a lot of it shows, yeah, you're either same day or you're greater than 30 days. But I think we want to get a little bit more information, because that greater than 30 days can be skewed by a lot of different appointment types like physicals and follow-ups. So we can go into the visit type category, apply a very quick filter, and now we're looking at just new patient lags. And these new visits really give us some more insight to say, yeah, look, we're really 14 to 30 days out or more as far as our appointment lags for new patients. That's not really an acceptable thing that we want to see. So we really need to break it down and look a little further.
And this is another example of where we can quickly see outliers up in the third next area. I've got several providers that are clearly above my target line of that 8 days for a third next available appointment. And of course, as we move up in days in third next, that's going to impact our appointment lag numbers as well.
So once we get into something like this, it makes me really want to dig in a little bit more into utilization. You can see there's some utilization outliers on the prior one, but I want to dig in and really try to understand my capacity and what's being used as far as individual providers that are out there. So when we come in here, you can see right away capacity percent of day of work, and you can see immediately there's an issue. We're not even offering any availability on Monday mornings or Friday mornings. We're not necessarily filling on Tuesday, Wednesday, Thursday, but what's really interesting is to see that on Monday and Friday in the afternoons, we're at over 100% capacity. Well, what that means is they're booking time that is not available in the template. And so when we see things like that, it makes us question, are we really templating as efficiently as possible? Is there maybe the ability to open up some additional capacity on those days of the week where we're struggling? And again, is it a staffing issue or is it a provider issue? How can we really improve those levels? Now, when we talk capacity and we talk all of these getting patients through the door, it becomes a patient satisfaction issue. And patient satisfaction, particularly with access, can be measured directly most of the time. And what we're looking at up above is you can see patient satisfaction by individual provider. And you can see who are the ones who are doing well versus the ones who are maybe not doing so well. And you can look at the differences in capacity between those providers who aren't doing as well versus the ones who may be.
So, Scott, let's talk about some ways we can communicate all of this, like the capacity information to providers and others who need to have this information.
And that's a good point, because up to now what we have been looking at is all of these metrics at a department or division level. And if we really want to change things, and obviously this is all about managing change, we do need to communicate with our providers individually and directly. And so what you see here is a fairly simple dashboard visualization that could be provided to providers on a monthly basis or a weekly basis. And what it does is it just gives them the ability to very quickly see where they stand, where they were last month, what their last 6-month average was, where they are today. And by the use of trend indicators, they don't even have to go in and digest anything. They can very quickly and easily see red, yellow, green. They're doing well in these areas. Yellow, they're struggling a little bit, maybe borderline. And red is a place where there's immediate attention required. So looking at the visualizations these ways and communicating directly with providers can be very effective. One other thing that can be really effective is incorporating benchmarks, whether they're internal or external benchmarks. And I know we've done something along those lines as well, Kelly.
Yeah, actually, we're doing something similar here on this next dashboard. And this is actually a facility dashboard. And we're still looking at patient access measures, but we're bringing in NAHAM access keys to benchmark this organization against. And so for those of you that may not be familiar with the NAHAM term, that is the National Association of Access Managers. And so we're looking at several indicators surrounding the entire visit or encounter that really ultimately impacts that patient experience that you've been talking about. So we're looking at things like collection data, registration time, and insurance verification rates. And we can quickly see we are doing good because all of those green check marks in the good column tell me that. But when we look at the comparing against the better and best organizations, we're really only hitting 2 of our 6 measures in the better category, and we're not hitting that best category in any of our measures. So this dashboard really makes it clear and allows us to focus on areas where we might be able to move up to that better or best bracket. And I know that when we look at things like collections and insurance verification rates, we often think about how that impacts the bottom line and how quickly we're getting money in the door. But for an insurance verification rate, for example, if I'm a patient, and I have been a patient, who has received a letter in the mail a few weeks after their visit, my insurance that I haven't had in 3 years has refused my office visit for 3 weeks ago. So that means that I have to pick up the phone, call the practice, probably fax an insurance card. And so I have to deal with that after the fact. And I would argue strongly that insurance verification rates will impact my patient experience. So Scott, you've been talking about patient expectations. Do you have anything to add to that?
I think you make a great point that, up to now, we've really just been talking about kind of the scheduling metrics, but patient access really is more than that. At a facility level, it does include patient collections at the time of service, registration and verification. But I think it's really something that impacts patient experience. If you look at point of service collections, if we're effectively communicating with our patients, then they come to expect that some sort of financial expectation is there for them, whether it's a copay or a payment on a deductible. And that's very much something that can be managed as far as the patient experience goes, because a negative patient experience comes when they get a bill later on for an expense that was not expected or anticipated, and they don't necessarily know how they're going to be able to bring that up. But if we're communicating effectively, this helps us really manage that patient experience. One of the other things that I think really helps with the patient experience is thinking a little bit outside the box. How much time are they spending with our providers? Those clinical cycle times are things that not only impact patient experience, but there may be a little bit of hidden capacity in there sometimes if we really dig in and analyze that. So let's look right away at some visualizations that show what we're talking about with cycle times. Now, cycle times, again, is how long they're sitting in the waiting room, how long they're in the exam room, and then how long they're spending with the provider. And you can see in this visualization right here, in the very first chart, what it's showing is the amount of time that they're actually spending in the clinic versus what was actually scheduled in the template. And so you can see there's a pretty large disparity there, that we may have scheduled a 15-20 minute appointment, but our providers are spending more time than that with the patients. how is that impacting, one, wait times down the road, and two, what we can actually book into a session. You can also look at trends, and what stands out to me in this particular trend is you can see that our average time in the clinic in total has remained relatively constant over the past 6 months. However, if we look at just the time that's spent in the waiting room from the time they arrive until they're taken back to the exam room, that's gone up. And so if our total wait times are constant, but that goes up, that means that it's less time that's being spent with the provider. And of course, that's going to impact our patient experience. Now, obviously, there's a lot of variability in that, and you can see the total cycle times by provider in that center chart. And this really goes to speak to how our providers are a little bit different. But again, what causes this variability? When you can see a provider like Mike Allen at the top spending sometimes over an hour with patients, all the way down to Dr. Rodriguez in the middle spending sometimes less than 10 minutes, both of those could impact negatively on the patient experience. But when you look at it as well, that variability is something that also, it may be appropriate based upon the acuity of the patients and what they do, but it also is something that if we can work to more efficiently schedule based upon these amount of times the providers are scheduling, looking at the things as far as histories and vitals that are being taken by the nurses or the medical assistants, really working down that variability is something that can help us to possibly more efficiently create our sessions and our templates so that we can get the most of patients in that can be seen effectively by that provider, managing the way that they practice in addition to what the patients feel when it comes to that.
Scott, we've focused on measuring what's happening now or in the past, but let's talk about some ways we measure change and can really visualize and quantify some of the things that we're trying to focus and improve on, like capacity and cycle times and things. And so here's a quick answers dashboard. Just looks at trending and how we're comparing to prior time periods. So if we take a look at one of these measures like appointment lag days, and we're trying to get our patients into place, some things that are hopefully working to get our patients in faster, we can compare the prior year to what we're doing this year and really visualize there that we're doing a little better this year and getting our patients in a quicker fashion. And then, Scott, I think you have a more advanced dashboard where we can actually look to start to quantify some things for improvement.
Obviously, when we talk about putting this information out there, we can put all the information in the world out in front of people, but it doesn't matter if we're not going to change the way that we do things. And sometimes that can be a little bit difficult to manage. So this is a way that we found that can be effective, because what we're doing is we're kind of quantifying an opportunity financially that comes from making the changes that are out there. So what we're looking at here is just a change in the overall utilization made by the providers. And what you can see is that the providers on the left-hand side have actually decreased the utilization level of their templates that are out there. And by so doing, if you look down at the bottom, you can see that there is a financial loss that's shown reflective of the number of patients that didn't come through and the financial ramifications of those patients. So that really can be a speaking point, because it helps providers really understand their role in helping the organization achieve not just their productivity goals, but also their financial goals that are out there. Now, if we look on the right-hand side, we can see those who have done better. And those who have done better have shown a positive increase in the bottom line that they're contributing to the organization overall. So this, again, is an effective way to get people to move to change kind of the way that they're doing things by making this quantification that's out there. At the same time, this can also be a little bit complex with what you're seeing.
Right now, we only have that one provider in that lower left-hand quadrant. But if that number were to continue to grow, that provider is not even meeting our target, and they're also decreasing in utilization. So that lower left quadrant would be a place to focus on. Right,
and that's a great point, Kelly. What we're really trying to show by all of these visualization, and really kind of the main point of what we're trying to do here today, is to say these visualizations help you to look and see where is it going to be most effective for you to spend your time. it's not necessarily going to be time efficient to look at the ones who are doing the right thing kind of on their own. It's looking at the ones who are struggling, who have the greatest opportunity for growth, because any change that they make just goes directly to the bottom line. Now, obviously that visualization can be a little bit complex. When we're thinking about patient access as a whole, we can really pretty easily quantify it and know if we're successful by seeing, are we seeing more patients? Are we getting our patients in faster? And is our staffing reasonable? Are we doing the right things? Are we meeting our patients' demands? But I think the most important thing that we need to look at is that we could actually be doing great. We could have incredible access, but it doesn't matter if our patients don't see it that way. We really need to manage the patient's perception of our clinical access, and we need to understand it through looking at patient satisfaction scores, patient engagement scores, and return business of where our patients are coming in. Because the fact of the matter is, no matter what we think, a patient experience isn't excellent unless a patient thinks it is. And this is a competitive issue, and again, if we're not meeting our patients' demands, they will go somewhere that will. I want to thank you all very much today for your time and for joining us, and we look forward to seeing you on future webinars. So thank you, everybody.
Thank you, everyone. Have a good day.